Hello everyone, welcome to MR Learning Circle. So in today's video, we are going to discuss about section 8. In this video, in the previous video, we have learned about the normal microbiota, and in today's video, we will learn about the classification of infectious disease and the definition of nosocomial opportunistic and the mechanism of microbial pathogenicity. The video related to emerging infectious diseases have been tagged up here, and you can find it some even in the description box. So the list of the nosocomial infection and the opportunistic infection, I will send it on the Telegram channel. You can just go through it. So today we will learn about the infection and infectious diseases and the mechanism of microbial pathogenicity. And the topics of non-specific defense host antigen, this whole section will be completed in this week. Okay, so let's start with infection. What do you mean by infection? So infection is the successful colonization of a host by a microorganism. Means you have a host and this is your host and your microbe will come and it will colonize itself, means it will start living in the host's body. Okay, now infections can lead to disease. It can lead to disease. And which causes signs and symptoms resulting in the deviation from a normal structure or functioning of the host. Means if this is the normal structure of your host cell, but when your body gets infected, then for example, the structure of your body changes. This is just for your example. Okay. Now, the microorganisms that cause disease are known as pathogen. I have told you earlier also, pathogens are microorganisms that cause disease. Clear? Now coming to the classification of diseases. So it is infectious disease and non-infectious disease. Clear? Now coming to the infectious disease. So an infectious disease is any disease that is caused by the direct effect of the pathogen. Okay, that means your pathogen will be the sole responsible for your disease. Okay, a pathogen may be a cellular or non-cellular organism. Cellular means your bacteria, your parasites, fungus, and these are cellular entities. And acellular would be your virus, viroids, and prions. These are acellular entities of the pathogens. Clear? Now, some infectious diseases are communicable. Some are communicable disease, while others are non-communicable. Communicable means that they are capable of being spread from one person to another through either a direct way or indirect mechanism. Clear? So in infectious, infectious disease is disease which is caused by the direct effect of the pathogen. And these pathogen could be cellular entities like bacteria, parasites or fungi, or acellular entities like virus, viroids and prions. Now, they could be communicable, means they would be capable of transferring the disease from one person to another. Now, some infectious communicable disease are also considered as contagious disease. What do you mean by contagious disease? It means they are easily spread from one person to another. Now, not all contagious diseases are equal. The degree to which a disease is contagious usually depends on how the pathogen is transmitted. Okay, means if you know that how the pathogen is transmitted defines the contagious percent of that particular pathogen. Yeah, for example, if measles, you know the measles are highly contagious disease. It's highly contagious infectious disease and it is caused by, it is a viral disease. Clear, you all must be knowing that measles is a viral disease. Clear. Now, this measles can be transmitted when an infected person coughs or sneezes and an uninfected person breathes in the droplets. Means if one person is coughing, a person suffering from measles coughs or sneeze, and another person that is healthy or that is not infected with measles inhales the droplets of the virus. Virus containing droplets get infected. Hmm. Now another disease which is gonorrhea hmm, is not as contagious as measles because transmission of the pathogen. What is the pathogen? Which pathogen causes gonorrhea? It is Neisseria gonorrhoeae. It causes gonorrhea. Requires close intimate contact, usually sexual contact between an infected person and an uninfected. In gonorrhea, you need a sexual contact between an infected and a non-infected person, whereas in measles, it only the cough and the sneeze droplets does the work. Clear, this is the difference between contagious and highly contagious disease. Clear? Now, these diseases are contracted as a result of, now coming to another disease category of disease or the subclassification of disease which is known as iatrogenic disease. Now, these diseases are contracted as a result of medical procedures. Iatrogenic disease can occur after procedures involving wound treatments, hmm, catheter, catheterization. What do you mean by catheterization? Means you put a urine bag, catheter, or surgery if the wound or the surgical site becomes contaminated. Clear. Now, for example, just take an example that an individual is treated for a skin wound. He or she might acquire necrotizing facility. The disease name is necrotizing fasciitis. Clear. Now it is an aggressive flesh-eating disease. This is an aggressive flesh-eating disease. Now, if the bandage or the other dressings become contaminated by, for example, take Clostridium perfringens or one of the several bacteria that can cause this condition, what will happen? You can see now the condition will deteriorate and this will lead to iatrogenic diseases. It is a result of medical procedures. Means you have to be very careful while performing all the first aid or the dressings or the care which is given after the medical procedures. Now coming to nosocomial diseases. These diseases are acquired in hospital settings are known as nosocomial disease, which are acquired in hospital settings. Several factors contribute to the prevalence and the severity of this nosocomial disease. Now, what could be the prevalences or the factors that contribute? It could be like first one could be if a sick patient brings numerous pathogen to the hospital. You know, a sick person brings numerous pathogens to the hospital. And some of these pathogens can be transmitted easily via improperly sterilized medical equipment, bed sheets, call buttons, door handles, or by the clinicians, nurses, or the therapists who do not wash their hands before touching the patients. Means the improper condition, not you can say like not properly sanitized or way. So these diseases contract to another patient. This is one of the reasons. Now the second reason is many hospital patients have weakened immune system. Second is weakened immune system. If you are admitted in hospital, so your immune system would be weak, making so this makes them more susceptible to the infections. If your immune system is weak, you will be more susceptible to the infections. So now compounded to this, the prevalence of antibiotics in hospital settings can select for drug-resistant bacteria and can cause very serious infections that are really difficult to treat. First of all, you have a weakened immune system, and the cherry on the cake becomes like the prevalence of antibiotic resistant microbes present. And this leads to the severity of your disease. Clear? Now coming to another subdivision, that is zoonotic disease. Now these diseases are not transmitted between humans directly, but they are transmitted from animals to humans. Such diseases are known as zoonotic and sometimes referred as zoonosis. Now, according to WHO, a zoonosis is a disease that occurs when a pathogen, okay, always remember a pathogen, a disease causing organism is pathogen, is transferred from a vertebrate animal to human. And however, sometimes the term is defined more broadly to include disease transmitted by all the animals, even including your invertebrates. For example, rabies is a viral zoonotic disease which spreads from animal to human through bites and contacts infected with saliva. Okay. Now, many other zoonotic diseases rely on insects and arthropods for transmission. For example, yellow fever. Your yellow fever is also a zoonotic because it is transmitted through the bite of mosquito infected with yellow fever virus. Another disease is Rocky Mountain spotted fever. Clear? This is also transmitted through the bite of tick bite. Clear? Infected with, can you name the pathogen of Rocky Mountain fever? Okay, then note it down. It is Rickettsia rickettsii. Rickettsia rickettsii. Okay, this is your causative organism of Rocky Mountain fever. Clear? Now, coming to another topic, that is non-communicable infectious disease. See, non-communicable infectious disease is not spread from one person to another, as its name signifies it. For example, one is tetanus. It is caused by Clostridium tetani, a bacterium that produces endospore. Now, you can get a question. This microbe produces endospore, Clostridium tetani, that can survive in soils for many years. Now, this disease is typically only transmitted through the contact with skin wound. Okay, it is transmitted only through skin wound. These are the points you have to remember. Now, it cannot be passed from an infected person to another person. Means if someone is infected with tetanus, will not spread this to another person who is uninfected. Just remember that. It only transfers through skin wounds. And the causative, the thing that causes would be your endospore. Now another disease, that is Legionnaire disease. It is caused by Legionella pneumophila, a bacterium that lives within amoeba in moist condition. Now you can get a question, which microbes lives within amoeba in moist condition? So your answer would be Legionella pneumophila. Yeah. Now coming to, so any individual may contract Legionella disease via contact with contaminated water. If the water is contaminated with your positive organism, then you can but contract that disease. But once a person is infected, the individual cannot pass the pathogen to another individual. How by cough, sneeze, droplet, sexual contact? No, this disease cannot be transmitted from one individual to another individual. Okay. Now coming to another next topic, that is non-infectious disease. So non-infectious disease can be caused by a wide variety of factors. This includes genetics, environment, and what could you say, your immune system dysfunction, and many more. So, for example, sickle cell anemia. You know sickle cell anemia? It is an inherited disease. Hmm. It is caused by genetic mutation. Can you name the gene which is mutated? Let me know in the comment section. Now, various types of disease, non-infectious disease has been mentioned here. So the inherited, see the types of the non-infectious disease. Just remember this. Inherited disease, you can take a screenshot also. Inherited means you have inherited from the previous generation of yours. Yeah. Inherited, it is a genetic disorder. Example is sickle cell. Another is congenital, a disease that is present at or before birth. At the time of the birth of the child or before the birth of the child. So the disease example is Down syndrome. Another type is degenerative disease. It is progressive, irreversible loss of function. Example, Parkinson disease. It is the affected central nervous system. Another type of non-infectious disease is nutritional deficiencies. It is impaired body function due to lack of nutrients. Example, nutrients means if you want to, it is due to lack of nutrients, certain nutrients, for example, vitamin D, vitamin C. So, vitamin C deficiency causes scurvy, vitamin D causes rickettsia and osteomalacia. Endocrine. Now another type is endocrine. This disease involving malfunction of glands that release hormones to regulate body functions. Okay? Example, hypothyroidism. Thyroid does not produce enough thyroid hormone, which is important for metabolism. Another type is neoplastic. It is abnormal growth or benign or malignant. It is sometimes some form of cancer. Next and the final one is idiopathic. Idiopathic means disease for which the cause is unknown. You know, the idiopathic agent is not. For example, juxtafoveal retinal telangiectasia, dilated twisted blood vessels in the retina of the eyes. You don't know the causative agent or the idiopathic agent of this. Clear? You can take a screenshot or I can even post the picture on the Telegram chat. Now coming to the stages of disease. So there are 5 periods of disease or the 5 stages of disease, which is the first one is incubation, followed by prodromal phase, illness, decline and convulsion periods. So starting from the incubation period. Incubation period occurs in the acute disease. In an acute disease, after the initial entry of pathogen. After the initial entry of the pathogen, when your pathogen enters in the host body, this incubation period starts. So it is during this time the pathogen begins to multiply in the host. However, there are insufficient numbers of pathogen particles present to cause signs and symptoms of the disease. Clear? Now, this incubation period can vary from a day or two in acute disease to months or years in a chronic disease, depending upon the pathogen. The factors which are involved in strengthening the length of the incubation periods are diverse. Well, there are diverse factors. This can include the strength of the pathogen, how powerful your pathogen that has entered, the strength of the host immune defenses, mean how what is the strength of your immunity system, the site of infection, where it has infected, where it has entered, the type of infection, and the size of the infectious dose received. Means either it is a smaller size, your pathogen has given a smaller infectious dose, and during this infectious period, the patient is unaware that he or she is going to develop or there is going to be a beginning of a certain disease. Clear? So you can say that the pathogen start multiplying in the host cell in your incubation period. Now coming to the prodromal period. The prodromal period occurs after the incubation period. Clear? During this phase, the pathogen continues to multiply and the host begins to experience general signs and symptoms of illness. Means, what are your general signs? Such as fever, pain, soreness, swelling, inflammation. These are your general signs of illness. And this happens due to the activation of your immune system. This happens due to the activation of immune system. Now, after this, the patient usually feels the signs and symptoms that are too general to indicate a particular. When the signs and symptoms that develop are the general signs and symptoms like fever, pain, soreness, swelling, inflammation. These are the general signs. You cannot define a particular disease or which disease you have contracted or which pathogen has infected in this period. Now coming to the illness. Now, in this illness period, your signs and symptoms are very obvious and severe. Means now you can define which disease you have contracted or something like that. Now, coming to the period of decline. Period of decline. In this period, the number of pathogen particles begin to decrease. Your pathogen start decreasing, and the signs and the symptoms of illness begin to decline. This decline. However, during the decline period, patient may become susceptible to develop secondary infection. It is in this that the patient starts become susceptible for different because of their weakened immune system due to the primary infection or the primary illness that it had caused. Hmm. Now, the final period is the period of convalescence. During this stage, the patient generally returns to normal function. Although some disease may inflict permanent damage that the body cannot fully repair, but this is the period where the patient usually returns to its normal function. Clear? Now, let's come towards how pathogen cause diseases. Now, the stage of the pathogenesis are exposure, means the contact, adhesion, invasion, and infection. Now, starting with your exposure. So in exposure, it is an encounter with a potential pathogen is known as exposure. When you encounter a potential pathogen means a pathogen that is capable of causing the disease. That is your potential pathogen. So in this, an anatomic site through which the pathogen can pass into the host is known as the portal of entry. Now just listen to it properly. These are the locations. These your portal of entries are the locations where the host cells are in direct contact with the external environment. Means this is your host cell and this is your external environment, and it is in direct contact with the external environment. Now the mucosal surface you know that are most important portals of entry for microbes. Means your nose, your mouth, and these are the mucosal surfaces that are the most important portals of entry of microbes. Now these includes the mucous membrane of the respiratory tract, the gastrointestinal tract, the genitourinary tract. You know, naak, moo, and the genitourinary tract. These are the places where the mucous membrane is present. Although most mucosal surfaces are in the interior of the body, some are contiguous with the external skin at various body openings, including eyes, nose, mouth, urethra, anus, and all these, you know. Now, most pathogens are suited for a particular portal of entry. You have to remember these words that some pathogens are suited for particular portal of entry. So a pathogen's portal specificity is determined by organism's environmental development, or environmental adaptation is the appropriate word. Yeah. And by the enzymes and the toxins they secrete. And what is this? Enzymes and the toxins they secrete. Clear. Now the respiratory and the gastrointestinal tract are particularly vulnerable portals of entry because gastrointestinal opening means your mouth and your nose, because particles that include microorganisms are constantly inhaled or ingested. You have to remember. Means your nose and your mouth, in simple terms, you can understand they are the most vulnerable portals of entry. Because you inhale, you eat something, you are breathing something, breathing this air, and you know your pathogens have get entry through these portals. Now, the pathogen can also enter through the breach of protective barriers of the skin and the mucosa membrane. These pathogens are very smart. They can enter by breaching your protective layer also. The pathogens that enter the body in this way, they are said to enter by the parenteral route. Parenteral route means through your skin or through your mucous membrane. The word is parenteral. You have just remember the word is parenteral, not parental, parenteral. It means through your skin or mucous membrane. For example, now taken for example that skin is a good natural barrier for pathogen, you all know, but when the skin breaks, wounds breaks means you get a wound or you get an insect bite or animal bite, needle prick, anything. This can provide for a parenteral portal of entry, means it is entering through your skin. Clear. Now coming to the pregnant woman. What happens in pregnant woman? Now, if the placenta normally prevents, if this placenta normally prevents, you know, this placenta normally prevents microorganism from passing from the mother to the fetus. But there are few pathogens. There are some mischievous pathogens that are capable of crossing the blood placental barriers. You have So the pathogens capable of crossing the placenta membrane, placental barrier is known as torch infection. See, T, it is an acronym given for the infections. The first one is toxoplasmosis. It is caused by Toxoplasma gonadai, it is a protozoa. Syphilis, chickenpox, hepatitis B, HIV, and the fifth disease that is known as erythema infectiosum. These are caused by bacteria and the virus. Syphilis is caused by Treponema pallidum. Remember in this you have to remember the positive agents also because you can be asked in your examination. Now chickenpox, varicella zoster virus. Hepatitis B, hepatitis B virus. And HIV, it is a retrovirus. And the fifth disease, erythema infectiosum, it is caused by parvovirus. See, these are some important diseases which could be asked in your exams. R signifies rubella. Rubella is caused by Tuga virus. C, cytomegalovirus, human herpes 5. And the herpes, it is herpes simplex virus, type 1 and type 2. So this is your torch infection. Okay, now coming to adhesion. Adhesion, after the initial exposure, the pathogen adheres means it sticks at the portal of entry. The term adhesion refers to the capability of pathogenic microorganisms to attach to the cells of the body using adhesion factors, and different pathogens use various mechanisms to adhere to the cells of the tissue. Clear? Now adhesins, what are adhesins? Are present on the adhesins are something that is used thing used for adhesion, for attaching themselves. They are present on the fimbriae and flagella of the bacteria, cilia of protozoa, and capsids or membranes of virus. Cilia and capsids or membranes of virus. Yeah. Different molecules are present, either protein or carbohydrate, called adhesins. They are found on the surface of a certain pathogen and they bound to the specific. These are your molecules and they have specific receptors and they will bind to the specific receptors of your host cell. Yeah, this kind of interaction is very specific. Now, this was about your adhesion. Now coming to the invasion. After the adhesion is successful, your invasion proceeds. This invasion involves dissemination of pathogen throughout the local tissues of the body. Dissemination means spreading out. Disease means after disease, that pathogen is now completely into your body. It is spreading all over. Okay. Now these pathogens may produce exoenzymes or toxins which serve as virulence factor. Virulence means disease causing factors that allow them to colonize and damage the host tissues. These what exoenzymes are uska, what is the role? They colonize or damage the host tissues as well as they produce virulence factors that protect them against the immune defense system. And now what is the role of exoenzymes or toxins? You can there are two roles, that they colonize and damage also, as well as they protect them against the immune defense system of the body. Now coming to infection. Infection means successful multiplication of pathogens that leads to infection. Once your pathogen has multiplied successfully, now 1 has converted to 10, 10 has converted to 100, 100 to 1000 and so on. This is your successful multiplication which leads to the infection. Now your infection can be described as local, focal or systemic depending on the extent of the infection. So local is confined to small area. Focal is confined to a localized pathogen or the toxin it produces can go to another, from one location to another. This is your focal. And systemic means it spreads in your whole body. Systemic means in your whole system. Okay. This is all about infection. Now coming towards the exoenzymes. What are exoenzymes? See, some pathogens produce extracellular enzymes or exoenzymes. These enable them to invade the host cell and deeper tissue. What this exoenzymes do, it helps to invade the host cells and deeper tissue. Exoenzymes have a wide variety of targets. Now you know the targets. Let me show you the targets. See, the class is like class 1 is glycohydrolases. They are example, what is the example? Hyaluronidase S in Staphylococcus aureus. You can be asked a question that Staphylococcus aureus has this or this, so you can write hyaluronidase S. What is the function? It degrades hyaluronic acid that cements cell together to promote spreading through tissues. Another one is nucleases. It is DNAs produced by Staphylococcus aureus. Okay. So this nuclease degrades DNA released by the dying cell that can trap the bacteria, thus promoting spread. Now the third one is phospholipase. Phospholipase C of Bacillus anthracis. This degrades phosphobilipid layer of the host cell, causing cellular lysis. Lysis means breakdown, and degrade membrane of phagosomes to enable escape into the cytoplasm. Last one is your protease. It is collagenase in Clostridium perfringens. You could be asked the question, collagenase is found in which microorganism? So just remember it is found in Clostridium. Another one, what is the function of protease? It degrades collagen in connective tissue to promote spread. Clear? These were the some classes of exoenzymes and their targets. Now coming towards the toxins. See, the certain pathogens are able to produce toxins. They are the biological poisons that assist in their ability to invade and cause damage to the tissues. So your toxins can be categorized as endotoxins or exotoxins. So there is a list of endotoxin and exotoxin produced by bacteria. Characteristics: endotoxin, exotoxin. Sources: gram-negative bacteria for endotoxin, for exotoxin, both gram-negative and gram-positive bacteria. Composition: lipid a component of lipopolysaccharide, and the composition of exotoxin is protein. These are the MCQs. These are the MCQs questions. Just take a screenshot. Now, what is the effect on host? It is a general systemic symptom of inflammation and fever. Now, in exotoxins, specific damage to cells dependent upon receptor mediated targeting of the cells and specific mechanism of action. What is the heat stability? It is heat stable, and exotoxin is mostly heat labile. Labile means it is affected by heat. And LD50 is high in endotoxin and it is low in exotoxin. So now your homework is to define what is LD50. Just let me know in the comment box and I will describe it in the another video. So that was all for today. I hope it was beneficial for you. And if you're new to the channel, please subscribe the channel and share it with your friends. Like, comment. Thank you. Bye. Take care.